we need to continually exercise and eat clean to help them reset.
Don't exercise. All what your body does is go to a lower calorie burning state.
Is that why doctors prescribe birth control?
Facial appearance, particularly the hair
Hair
growth,
growing,
which
okay.
is the high testosterone,
Testosterone,
as opposed to estrogen.
Do not skip your birth control.
And losing weight is number one.
We can battle PCOS, right? PCOS, weight gain, inflammation, what is going on with my body? I'm just a girl. If you have these questions, this is the video that you need to watch. Today we are going to be answering all these questions on PCOS and hormones. We are with the country's first endocrinologist. We are with Dr. Noel, who has been practicing this for the last 3 decades. So, hi Dr. Noel, we are
Hi.
so happy to have you today.
Hi, Sari.
Thank you so
Sarani,
much.
thank you for collaborating and thank you for inviting me.
Right
for
back
this.
at you. I was going to say thank you so much for having this conversation with me today, because I've been doing coaching for the last 8 years, and the number of PCOS cases are increasing, and honestly, I do not have an answer. Like, I don't know why. Those days it was 1 or 2 girls, and now it's every other girl. So I'm
Yes.
like, is it something in our food? Let's answer these questions, okay?
So, for those of you who don't know Sarani, Sari by physics is probably more familiar.
Physics by Sari is
physics
more
by
familiar.
Sari is more familiar. She's been in this field for a long time and lots of you follow her. So, I mean, I don't think I need to introduce her to you.
All right.
Yeah.
That's flattering. Okay. So, shall we begin?
Yes.
Okay. First and foremost, people say, oh, I have PCOS or PCOD. But is there a difference, doctor, or is it the same?
Yeah, it's just the same thing. PCOS is the standard terminology now. At the end is a syndrome. Polycystic ovary syndrome, as opposed to polycystic ovary disease. When they first started speaking about it, they started speaking of it as one disease. But syndrome means there is a cluster of many things going on in your system, in your menstrual, in your rest of the hormones, the face, the skin, the fertility, and all that. So, in order to recognize that, they termed it a syndrome, it's a cluster. So that's why we call it PCOS rather than PCOD. But it's the same thing.
Okay. And all this is because there are cysts that are developing in one or both ovaries.
Yeah, so once again, the name is a misnomer. Sorry to disrupt the expectation in that. So actually, polycystic ovary just means that when you do a scan of the girl's womb, the ovary, you see multiple follicles, which are actually immature follicles. So every month, as you know, there should be a menstrual cycle. And from then on, the hormones do a dance. They do pulsatile secretion. You get one egg that develops. That becomes the ova, what we call the egg that is ready to be fertilized. So if there is fertility chance, that becomes the baby or the embryo. If that doesn't happen, you just lose that. And then 14 days later, you get the period, because the womb has to be cleansed again and then go through the same dance monthly.
Every month.
So if you don't do that every month, and if you just have fake hormone signals or imbalanced hormones that are just working in the ovaries, you get just fake follicles. So some of them will have 3 to 4 to 5, some of them will have 10 follicles that are looking like a cyst in the ovary. And when a scan is done, sometimes you just go for a scan for something else and they find that there are multiple cysts or these follicles in the ovary, which means that the hormones are not in sync and that you are not ovulating properly, because usually the ovulation cycle means, or the menstrual cycle means, there'll be one egg that's ready to be fertilized, and then the fertility chance is higher.
Every 28 to 30 days.
Every 28 to 30 days. So this is like what we call the rhythmical dance of the hormones. It's like a choir that practices, it goes all of them in sync.
Perfect.
And if the brain and the ovaries and the rest of the reproduction is not in sync, you have these what we call the fake ones, because that's actually not the real.
We just call it cysts now.
Cysts, yeah.
Okay. Because people get scared. Oh my gosh, is it cancerous? This and that. They are just They're just ovas that never made
yeah.
it, you guys. So chill
The
out about that. It's not that deep.
yeah, so you don't actually need to have it also. Because it's
Okay.
just one feature of it. You don't need to have it. So some of them will just have a bulky ovary. Some of them, which means that the ovaries are slightly larger than usual.
Okay,
Some of
so
them
even if
actually
you
don't.
don't have those, sorry to
Yeah,
butt in, even if you don't have those little cysts or follicles, you can still
you
have
can,
PCOS, is
that's
it?
right. That's right. So
Okay.
so you can still have it because what is actually more important is what's happening in your system as hormones. Are they in sync? Are they, when I say sync, this pulsatile secretion. When you say pulsatile, these
You keep doing
hormones,
this. Is it because
yeah,
it's secreted
yes,
from the
yes,
front of the brain?
yeah. So the inside the brain, somewhere here in the middle, you have this master gland called the pituitary. Once
Okay.
again, this is controlled by the upper part of that gland called the hypothalamus. So
Hypothalamus.
they are the master gland. So they decide whether you were to live or die. They decide whether you will grow, whether you become a male or a female, and what kind of hormones you produce is
So what did
decided
he
by
say?
the.
Pituitary gland, hypothalamus. Okay, remember these things.
Yeah.
Master glands. Okay, they decide everything.
So they do decide in females the pulsatile secretion of these two hormones, LH and
Okay.
FSH, we call them.
Okay.
They work on the female reproductive system, that is the ovaries and then the uterus. And so listening to these two hormones, the ovary starts maturing one oocyte after the other. So because when a woman is born or when a baby is born, she carries millions of these eggs inside her in the ovary. And one of them matures every month, and that is in listening to those two
Glands.
hormones that come
Okay.
from that.
Right.
And then you get your secondary sexual characteristics, we call it. So because when the ovary listens to the LH and FSH, it starts producing the female hormone, estrogen,
Okay.
that gives the features, the
Okay.
secondary sexual characteristics, as we call them. But the LH and FSH are the ones that are needed to be secreted in balance, that is in a particular ratio at every time, so that the egg knows that it is now in maturing phase, now it's waiting for a fertility, now it's in a shedding space,
Okay.
and so on. So that cyclicity is controlled by the master gland.
Okay, so what we are trying to get into, I think what you're trying to say is, doctor, if I may intrude, is that when the body doesn't listen to these glands, or when the body doesn't release, the glands don't release the hormones properly, is when we get these irregularities in our problems,
Yeah.
and that's where these problems begin. Is that correct? Is
In
that what you're
short,
trying to
yes.
get to?
In short, yes.
Okay,
Yeah.
so what we're trying to figure out is why? Why do women
Mm.
have PCOS, doctor? If I may come to our next question,
Yeah.
why do you think? So it's in two parts.
Yes.
One, why do you think a woman gets PCOS? Because these things don't work properly. What is it that leads to these glands malfunctioning and these hormones malfunctioning? And second thing, why do you think that PCOS is so common today than a decade ago?
Long question. Just to cut it short, if you become insulin resistant by any means, usually it is our food patterns, and usually it is also weight gain. So unhealthy modern lifestyle leads us to a condition called insulin resistance. That is, you need insulin from the pancreas, though it's not usually a fertility hormone, but for most of us it controls fertility also, because you have to be nutritious and your body has to be healthy in order to also bear a baby. So if there is by any chance insulin resistance, which is usually us gaining weight, having too much fat, the gaining weight is usually having fat
Too
tissue
much
all over the
carbs and
body.
too much sugars and just too many
Exactly.
calories.
Exactly.
Okay, insulin gets tired of fighting.
Yeah. So the insulin has to work harder every time we provide glucose surges to our body. So when these surges happen, you eventually get insulin resistance. That's
Okay.
because the fat tissue is always fighting with the rest of the body, called inflammation.
Okay.
And so when this imbalance happens in the body for other reasons, not fertility, but by us eating or by not exercising adequately, some will say,
Okay.
this mismatch between what we eat and what we can burn out happens, insulin resistance occurs. So when insulin resistance occurs, the pituitary and the hypothalamus senses it, and I think so if you see, you have to be physically fit in order to reproduce. So the chemical switch comes from that the now the body decides not to reproduce.
So, in short, doctor, this you're giving us the answer for our next question, which is
Yes,
why
right.
do women with PCOS find it harder to lose weight,
Yeah.
even if they're on a sometimes even if they're on a calorie deficit?
Yeah.
So that would be a second part.
Yeah.
Because for me, I feel like as a coach, once they're in a deficit and once they do exercise for a while, after 3-4 months of even no results, then they start to see results.
Yes.
But you just have to keep being consistent.
Yeah.
That's what I have learned from my PCOS clients, because you need to, that more than any medicine, you need to exercise and eat clean and help your body to come back to its normal regulation, right?
Yes. So my
Yes.
like my trainer would say, look, this didn't come to you, even for me. All of a sudden, it wasn't a one-day
Yes, it
problem.
was
You've earned it through your life. So he will say,
lifestyle.
yeah. So he'll say, look, it's not going to go away in a while. You need to keep at it, as you say. So because of insulin resistance and inflammation, it's going to be harder than usual to lose weight. It is a fact. And we also think that the hypothalamus and the pituitary, they are very complex. We just simply say insulin resistance, but there's a lot more
There's
going on
so
within.
like
Yeah.
thousands of other chemicals
Yes,
and
going on.
chemical combinations.
That's going
A
on.
lot of chemistry and bio going on in there. So
Yes.
it's not just just these two.
Yeah.
But I think what doctor is trying to say is that we need to continually exercise and eat
Yeah.
clean to help them reset.
That's right.
Why do you think, doctor, why do you think that exercising for a couple of weeks, months in a row will help you come back to normal? What does the body understand and start to do with that exercise and nutrition?
So, if you just cut calories and don't exercise, all what your body does is go to a lower calorie burning state. So, lower metabolic rate, we say. In all that, what the body is trying to do is to keep the weight. So, the weight or fat for the body is gold. It is programmed to preserve your fat for your own survival. When your ancestors were in the jungle and they had to, they'll eat today, then they'll hunt again tomorrow, it might
Run miles
fail.
and miles.
That's
So
right.
they need fat for
Yeah.
energy.
So they need fat. So the body is programmed to look after the fat like it's gold. And it's not going to just let it go all of a sudden. And it's going to fight tooth and nail to keep
To
that
keep the fat.
adiposity.
Okay.
If when you lose weight, there are other regulatory things within the body. We know that increase your appetite and they make you lose the fat burning ability and so on to readjust your body to the earlier homeostasis or that balance where the fat tissue remains the same. And because the body will fight tooth and nail for that energy store, because for the body's programming, that is like a fat store.
Stay fat, you're healthy.
That's
So
what it
body wants
thinks.
to
Yeah.
thinks that, okay, if she's hungry, if she's starving, she's
Yeah.
not safe. The body wants
That's
to
right.
be fat. Then what about inflammation?
So we need to, just to finish that, we
Okay.
need to tell the body that no, I need higher basal metabolic rate, which is by exercising. So that's why both of them go hand in hand. So not just cutting down calorie, but to tell the body, no, this fat has to be now burned for energy, otherwise survival is at a problem.
Okay.
So that two programs. So inflammation is adipose tissue secreting various chemicals, and that will damage various things. So one first thing for a PCOS person will be that their insulin resistance goes up, and it becomes harder to do everything, and it's a cycle that goes to make the PCOS worse. On the other hand, we also know that people with PCOS, when they live longer time with the same amount of fat in their body, they have other diseases. That's why we now call it a syndrome rather than a disease, because you can have increased risk of cancer, increased risk of heart attack, and all that. That is this inflammation
Hair
mediated.
loss, hair thinning, all those things are like a what do you call it, it just continues and continues.
That's
There are
right.
like a lot of side effects of having PCOS and having PCOS for a long time.
That's right.
So that's why you shouldn't just stay in that condition, right? So yes, continue, doctor.
So yeah, so it's not difficult. Okay, it's difficult to lose weight for anyone. So it's not impossible to lose weight. It's just that
Yes.
somebody with a PCOS, because there are lots of other things going on, and there has been decades of programming within the body, you may not break the shackles within a short time.
Yeah, now I don't want you all to make this an
Mhm.
excuse. I have PCOS, I can't lose weight, therefore
Yeah.
henceforth body
Yeah.
positivity, I'm gonna be this size and you better love me. The reason that as a coach, as your friends, your family, the reason we are telling you to lose weight is because, not because we don't love you or that you look unpleasant. It's because that you are at a risk, like doctor said. When you get this syndrome, so many things are at risk. Doctor, does the ability to have a baby in future, is that affected because of long term PCOS?
Of course, yeah. So because this is all a fertility problem anyway, because the very name PCOS suggests that in the ovaries you don't get one ova that is designated as that month's,
Baby maker.
ovulator, baby maker is not done. So sometimes you have five which are not properly mature, and that's why you have multiple cysts. Say every month you need to have one designated egg that comes out, and so if you have at least 8 to 10 cycles a year, if not monthly, if at least 8 to 10 cycles, then your chance of fertility are much higher. We call it oligomenorrhea, or lower number of periods, when it's much lower than that. Then
Irregular.
irregular, because then two things are not happening. One is that this womb has to be, the uterus has to be cleansed every month, so that you're detoxed and future cancer risk is lowered and all that. And on the second hand, the egg has to be matured every month in order to prepare for future fertility, and that doesn't happen as well. So
I
that's
think I think here I learned a new thing right now, where as doctor said that the ovary has to be cleansed in order for future
uterus,
the
uterus, yeah.
uterus has to be cleansed. So is that why doctors prescribe birth control to induce the monthly period for girls, because they want to cleanse the uterus?
Yeah, so what happens when you haven't had a menses or a period for some
4 to
time?
6 months
Yeah,
sometimes.
so then the actually, if you, when you do a scan, you can see the wall of the uterus has become very thick. It's actually tissue built on one on top of the other, and that can actually in future turn into cancer, because we haven't
Wow.
done what was supposed to be happening monthly, which is the
Wow.
shedding and forming a new layer.
Do not skip your birth control. When the doctor says you take it, you take it. Okay? You learn these things
Yeah.
now.
So the
Carry on,
birth
doctor.
control pill also does another thing in PCOS. Lots
Okay.
of women hate it. They think it's a cover up. Yes, it is a cover up. It's how we see as hormone specialists as a temporary stopgap measure. So
Like a
you have,
band aid.
yes, so you have this chance to relearn your health, lose weight, start exercising, to kickstart the spontaneous. Normally it doesn't happen, and in the meantime you are at risk of multiple other things, the facial appearance, particularly the hair
Hair
growth,
growing.
yeah, which
Okay.
is the high testosterone
Testosterone.
as opposed to estrogen. And then they have this period problem where the periods have not come every month, and you have this endometrial hyperplasia which we worry about.
Is that when you get a lot of pain?
Sometimes,
Okay.
sometimes, but mainly we worry about their future malignancy risk.
Okay. Okay.
And then lots of other things. There is psychological worry about not being menstruating monthly and all that. Then mothers are behind you asking what's happening,
Okay.
all that.
It's a bit scary. Lot of
Yes.
allegations.
Yeah. So the hormones reset this. I started by pointing at this brain and
Yeah.
saying this LH and FSH. The hormones, when we give estrogen and progesterone cyclically, they not just work in the uterus to restart this period cycle, they also reset this, these erratic, crazy hormonal surges. So then,
What do you mean erratic, crazy hormonal surges?
yeah, so if you actually measure the hormones, you will find that the LH and FSH, which are supposed to be in balance and come in pulses, are not doing that.
Okay.
So that's why you will usually see LH multiple times higher than the FSH. So these are just two hormones and they are not in sync.
Okay.
That's what I meant by not in sync. They are supposed to do a job of stimulating the ovary. They are unable to do that because they are not coordinating their job.
Okay.
So that's the erratic cycle we see. So when we
Okay.
give the hormone signal, estrogen, we are telling the brain to stop producing those hormones. We are giving the estrogen from outside.
Okay.
And then after a while, the brain resets that cycle. So it's like restarting a
Okay.
computer, so to speak. So you
Wow.
restart that cycle, and that gives your hypothalamus and ovary to pituitary to recover from PCOS.
From the erratic things that
From the
they've been
erratic
doing,
things
just to
been doing.
reset and
Yeah.
giving your
Yeah.
pituitary and all a time to
Yeah.
rest and to, in
Yeah.
layman's terms, to rest and recover.
Yeah.
And we are giving the estrogen, which is the birth control pill, so that your body can try to reset.
Yeah.
So, doctor, I want to ask you, when a girl has PCOS, do they become different mentally? Are there any negative side effects to their mentality, their motivation? Do you get depression? Do you see a change in moods when a girl is diagnosed with PCOS?
Not always, but yes, because there are so many other things that have happened to their body. That's what usually worries them. It's hair growth, it's acne, which is sometimes scarring. They think, why is my cycles irregular?
Why am I gaining weight?
Yes, right. And they
Okay.
also have this imbalance of, this female hormone, estrogen, as opposed to very little male hormone in their body. Now they have several of those male hormones in higher concentration than normal. That's what drives the hair to go and the hair to
Okay.
fall. Like men, we call it the male type baldness because in the sides you tend to lose, which is not a feature of estrogen.
Estrogen, okay.
Yeah, and the acne, once again, testosterone drives it, and the male hormones drive it. The hair growth in the beard is a male feature. It's the feature of testosterone being too high.
Too high. So when
Yeah.
girls get these side effects, it makes us, I think the girls get really upset,
Yeah.
and I think it's like, do the hormones make you sad, or does the what doctor is trying to say is that the effects from having PCOS, especially long term, will make a girl feel really insecure, if she's gaining
Yeah.
weight, if she's getting facial hair and she's wondering why she's going bald, now hair is thinning, and overall, like, a woman loses her beauty. Then apart from that, there's a lot of demotivation, doctor, when
Yes.
they try to lose weight and it takes them time. They think that what they're doing is not working, so they just abandon the whole project.
Yes.
So that's what we're trying to say. What I'm trying to get to as a coach, and motivation is my forte, and looks like science is definitely doctor's forte. So coming from a coach's perspective, I want you guys to keep at it, keep being strong, and keep being consistent, because like doctor said, if you combine our medicine that doctors give and the coaching and the exercises and the meal plan and the nutrition and just an active lifestyle, even a couple of steps a day, we can do this. We can battle PCOS, right? We can lose the weight, but you have to be consistent and allow your body medically and naturally. Together we can allow it to reset. Give it some time, 4 to 6 months, even 4 months. After that, you will start to shed the weight and your body will start getting healthy. Do you agree, doctor?
Yeah. So as you said, the cornerstone. So whatever tablets we give are temporary. They are sometimes cover up, you may call it, because we are trying to cut down these symptoms of acne and the hirsuti and the hair growths and the hair fall and all that, which do tend to respond to medication. They are temporary. So we usually look at it like a 2-year program in order to get the hair out and all that. So even for laser to work, you need some blocking of the androgen, the testosterone inside.
Otherwise, it just grows back.
That's right. But always the science is that lifestyle changes are the number one. Losing weight is the number one. So if you do that, your hormones reset automatically and your long-term health, because we call it a syndrome. It's not just about getting monthly periods. It's about your overall survival and preventing so many things: diabetes, high blood pressure, high cholesterol. All these are features of this insulin resistance and inflammation. So you can reverse all of that.
Is it curable, doctor, or is it a maintenance
Yeah,
kind of
yeah.
sickness?
So in medicine, we don't call anything cured. We call it remission, which is good enough.
Which
So
is reversing the
which
effects.
is reversing the effect. So we are not giving you a new body, but we are training you to live with your body, which had problems for some time,
Okay.
to minimize those problems. So in one word, you can say we are curing, because fertility is certainly
Yes.
restorable.
Okay.
All
Great.
of
That's
your other
great news.
metabolic problems are restorable just by
Yeah.
losing weight normally.
Say that again.
Yeah.
Say that
So
to the people at the back.
yeah.
Say it again, doctor.
Yeah. So
Say that
it's
sentence again.
in every research you find that, and that's what we stress on. You look, lifestyle is the changes that you make to your life, and losing weight is number one.
Thank you.
Medications are, you may call it cover up. We have multiple things for weight loss. We have hormones. Um, you can use local therapies like acne treatments, laser treatments, but they are all just on top. They are like the
Yes.
icing, let me call it. And but the main core thing is to look after yourself.
Look after yourself and your weight. Doctor, is PCOS hereditary? Are there any studies like that, or are we born with it, or does it just come later on because of lifestyle?
Yeah. So these days, South Asians are being looked at in a very focal manner, because if you go street to street or home to home and knock on people's doors and ask, okay, women, how about your periods? Are you getting regular periods? Uh, a big percentage are
I'm
now
saying no.
finding that their periods are not in sync. And similarly, if you check their blood pressures or cholesterol or their
NCDs.
sugars, you find that lots of these people are, these are coexisting two conditions. And that's why we call polycystic ovary syndrome, or also like having diabetes, because
Okay.
it's the same root causes. The cholesterol, the ones that drive the heart attack, are the same factors that drove us to get polycystic ovary syndrome.
Okay.
It's high insulin, high inflammation, and that's due to whatever lifestyle changes we have done. So
Right.
that's acquired, as in how we have lived is how soon we get PCOS. But in the background, as I said, South Asians are at high risk of developing diabetes and polycystic ovary syndrome, and it's
Okay.
quite common. So that way, yes, we have hereditary tendency, because in the past we lived a different life, high physical activity, very low food, and we would usually eat 1 or 2 meals a day in the past. And now we have converted it to 3 meals, and 3 meals
And
at
snacks in between.
yeah, and they are very, very calorie intense or dense, and that's what's driving. So it's hereditary, but then it's happening because we have changed our lifestyle.
All right, doctor. And in closing, I just wanted to ask you, if one of our viewers are suspecting, oh my gosh, do I have PCOS? What should be their protocol? What should they do?
So you can test yourself. So if you're, so how women will usually perceive this is something has changed. The appearance, the monthly cycles, or hair growth pattern, something has prodded you. And if so, you can check it. We can check the insulin level. We can check what is called the cyclical hormones to see what's happening. So people also have concerns, priorities, so to speak. Sometimes you are married, you have tried to conceive for a few years and you haven't found it successful. This may be the underlying cause. Of course, there are many other causes of subfertility, or unable to conceive is called subfertility. But this is possible to test, even to see whether ovulating normally and whether PCOS is driving that. So then hormones as well as scans, if necessary, can be done and checked. In addition, we usually check their liver functions, because lots of them have fatty liver, lots of them have increasing sugars, not diabetes, but increasing sugar levels, cholesterol's abnormal, and so on. So this is that whole spectrum that can be checked. But main thing is, and the good news is that it can all be reversed.
That's great to hear. So there is hope. Don't be upset. Don't fall mentally. Don't give up. That's what's important. I don't want you to give up and be like, oh my God, I'm so fat. I'm so ugly now. Because this is what I hear during my
Yes.
consultations. They are broken. They are just, they've come to a point of no return. Like doctor said, and I quote, everything is reversible. We can live a very fulfilled, confident, happy, healthy, and fertile life. We can have everything that we want to achieve. But what are we going to do, doctor? So, do we channel an endocrinologist if we suspect that we have PCOS?
Yeah, I think endocrinologist is the ultimate referral center, but you can go to your family doctor and talk about your concerns, and they are trained enough to run these tests. If you are found to have polycystic ovary, if fertility is your primary problem right now, urgent, then see a obstetrician. Otherwise, see an endocrinologist if it's long term we are looking at.
Okay, amazing. I learned so much during this interview. This interview is invaluable, doctor. Honestly, it's such a common thing, and I think every single female, whether you suspect you have PCOS or not, they should watch this video, and I'm sure the viewers got so much information and hope and knowledge about their body, and I'm sure you feel you're in control of this situation now. So, Dr. Noel, again, words can't describe how thankful we are for today. And please follow Dr. Noel. He's on TikTok, he's on Instagram. It's called Dr. Noel Knows. Facebook, YouTube. He's everywhere. Information is just at your hand. Subscribe to all his channels. My name is Sarini Tilkaratna. I go as Physique by Sari. And guys, thank you so much for watching this video. And we will join you next time.